डॉक्टर हमजा गौरी आ गए?
Yes, sir. Dr. Saab is here.
अच्छा, that's good. और इसहाक अलैहिस्सलाम?
Sir, he's having some family emergency. He's taking her wife to hospital.
Shopping.
No, hospital, sir. Hospital.
Shopping.
No, sir.
बहुत ही माशाल्लाह प्यारे आदमी है. नाइस, ऑलवेज नाइस टू हियर. चले जी.
सर, आपको हमारी आवाज आ रही है?
मुझे
आवाज आ रही है?
Some journeys aren't defined by a destination, but by their transformation. From passionate beginnings to defining milestones, the Pakistan Cardiac Super League became the heartbeat of academic excellence. Two pioneers joined forces once again to ignite the spirit of learning and leadership. What began as a challenge became a movement. In every round, a new hero emerged. In every team, a story was written. Now, the legacy continues as 16 elite teams step into the arena to prove their strength, their skill, and their synergy. Team LNH Pelicans, Team SGTH Tigers, Team BVH Cardinals, Team FIC Fighters, Team SICVD Thunders, Team AFIC Lions, Team PIC Hawks, Team Dow Dolphins, Team NICVD Kings, Team RIC Dreadnoughts, Team Looms Falcons, Team MIC Panthers, Team AQH Stars, Team BMC Strikers, Team HMC Stallions, Team PIC Warriors. Guided by the visionary stakeholders of the Pakistan Cardiac Society, steered by the Governing Council, the backbone of PCSL. Judged with fairness and integrity by our panel of expert umpires, and held together by the voice of reason and brilliance, Dr. Hamza Gowri, our moderator, whose pivotal presence made this league a resounding success. Glory goes beyond borders. The winning team will earn a prestigious opportunity to participate in an international cardiology event. Mark your calendars, the battle for brilliance begins August 9th. Pakistan Cardiac Super League, Season 3, the ultimate test of knowledge. Powered by Wilson's Pharmaceuticals.
Assalamu alaikum everyone, I am 𝐏𝐚𝐤𝐬𝐭𝐚𝐧 and welcome to Pakistan Cardiac Super League Season 3, brought to you by Pakistan Cardiac Society in collaboration with Wilson's Pharmaceuticals. Today once again we are live for the 8th match, which is going to be played between PIC Warriors from Peshawar and RIC Dreadnoughts from Rawalpindi. Before we begin, I would like to introduce the senior faculty members, the council members and umpires of Pakistan Cardiac Super League. We have with us one of the most revered figure of cardiology, Professor Mohammad Hafizullah Saab. Sir, thank you so much for joining. And we have today with us the match umpire, Professor Mohammad Ishaq Saab and Professor Abdulhamid Siddiqui Saab. They will be joining very soon. And we have also with us the President of Pakistan Cardiac Society, Professor Rajkumar Saab. And some more panelists will also join us and they will be introduced during the match. And last but not the least, I would like to introduce the voice of Pakistan Cardiac Super League. He is a consultant intervention cardiologist and a stroke interventionist, and you are all familiar with the name Dr. Hamza Zargori Saab. And I would now request Dr. Hamza Zargori Saab to please formally start the proceedings of today's match. So over to Dr. Hamza Zargori Saab.
Thank you very much, Hamza. Assalamu alaikum to all of you. So with this, I take this opportunity to welcome you all to this third season of Pakistan Cardiac Super League, which is brought to you by Wilson's Pharmaceutical in collaboration with Pakistan Cardiac Society. And we all know that these matches are getting more and more interesting. So here we have the 8th match of the league, and these are all knockout matches and extremely important. Today we have the two teams. So the fight is going to be happening up in the north. It is Peshawar Institute of Cardiology Warriors, and they are up against Rawalpindi Institute of Cardiology Dreadnoughts. And I am hoping for a tough fight today. But before we move on, I would like to welcome our dignitaries, and we'll start with our two umpires. It's Professor Mohammad Ishaq Saab and Professor Abdulhamid Siddiqui Saab. So they'll be joining in pretty soon. And our governing council members, we have Professor Hafizullah Saab. He's with us. Welcome, sir. It's great to have you on board today. So with this, I think without much ado, I'm going to move towards the two teams, and I'm going to ask the captains of the two teams to start with the introductions of their teams. So we'll start with PIC Warriors first. Captain, can we have the introductions, please?
Yes, thank you so much for having us. I am the captain of the PIC Warriors, Dr. Bilawal, and to my right, Dr. Azhar, and to my left, Dr. Osama and Dr. Burhan.
All right, so welcome to the show and best of luck to you. Now, moving towards the other team, and I do see RIC Dreadnoughts. Captain, I'll request you to introduce the team.
Assalamu alaikum. I am Dr. Maha and I'm captain of the team. To my left, I have Dr. Rusa, and to my right, I have Dr. Osama and Dr. Iqbal.
All right, so it's good to have you in this league, and we are definitely hoping for a very tough match today, and best of luck to both the teams. And as we all know, both the teams will have one innings each. They'll have 10 questions apiece. But before we move on, I think the weather is perfect. The pitch conditions look pretty good, and I think it's going to be a pretty high-scoring game. That's what I'm hoping for. But there, I've been told that we may just have a little bit of movement in the pitch as well. So let's see where we end up. And we move to the next segment, which is going to be the coin toss, which is done electronically. So can we have the coin on the screen? All right. So I'm going to randomly ask one of the teams, since I see RIC on the screen. Well, it's going to be heads or tails. So what do you call it? Heads or tails?
Tails.
So they're going to go with tails. Roll the coin, please. And let's see what happens. Oh, it's a heads. So you've lost the toss, but never mind. You know, things may still go in your favor, and I do see PIC Warriors. So Warriors, I'm going to put you forth with two questions. The first one, do you want to throw the questions or you want to take the questions?
Hold the question. we would like to throw the question, sir.
All right, so you're going to throw the questions. And now the second question. You have two cases in front of you, case A and case B. Which one would you want to select?
B.
So they have chosen case B, and the news from the center is PIC Warriors have won the toss. They want to throw the cases, and it's case B which is going to be thrown by them at RIC Dreadnoughts. Well, with this we move towards the council member. Sir, may I have the permission to start the game, please? All right. We do have the permission now from Professor Hafizullah Saab, and I think, can we have the scenario on the screen, please? And I'll request Warriors to read it.
A 76-year-old lady, known case of diabetics, hypertension, CKD stage 3, and history of the PCI to RCA back in December of 2024.
Okay, just hold on.
Am I audible?
Hold on.
Am I audible?
RIC, is there a problem?
Sir, question नहीं show हो रहा था.
Okay, so technical team, I think you will have to pin it on the screen. Is it pinned?
Yes.
Do you see the scenario?
Yes, sir.
Okay, the scenario is there. Please carry on.
A 76-year-old lady, known case of diabetes.
Show नहीं हो रहा. Scenario नहीं show.
Okay, just I think we'll hold here. So what's going on, technical team?
Sir, अब okay. Pin किया उन्होंने.
Okay, so it's pinned now. They are saying it's okay. Carry on, please, Warriors.
A 76-year-old lady, known case of diabetes, hypertension, CKD stage 3, and history of the PCI to RCA back in December 2024. Presented to the ER at 400 hours with complaints of central chest pain. On examination, her heart rate was 130 per minute. Blood pressure was 134/88. Chest auscultation showed normal vesicular breathing. An ECG was done that revealed an isolated ST elevation in lead 3 along with concomitant ST depression in V4 to V6 with a positive T waves. Her daily medication include aspirin 75 mg OD, clopidogrel 75 mg BD, rosuvastatin 20 mg at night, losartan 50 mg OD, metformin 500 BD, dapagliflozin 10 mg OD. She is usually compliant with her medications, but had missed some of her medicines in last 2 to 3 days.
All right, RIC Dreadnoughts, you have a couple of seconds to gather yourselves, and we'll start once you're ready. So during the course of the game, you can always ask for the scenario, and you'll have it on the screen. Yeah, you will be shown the scenario on the screen whenever you want it. So are you ready now?
Okay, sir. Yeah, show us the questions.
Okay, so they are ready. Can we have the first question on the screen, please? Read the question, Warriors, with the options.
What is the ECG diagnosis? Option A, inferior wall STEMI. Option B, inferior wall STEMI with RV infarct. Option C, inferior wall STEMI with posterior extension. D, Ellslenger syndrome. And E, none of the above.
All right, your timer starts now. You have 60 seconds to answer. And I will request the team which is about to answer to just hold on till the question is over. And once they're done, you can unmute and then start the discussion. And keep yourselves unmuted. We want to hear your discussion. And best of luck.
वेट करना है ना बोल रहे हो गया आप कह रहे
You have 60 seconds. Listen to me. You have 60 seconds. You can take all the time you want to. Don't be hasty. When you're sure, just tell us no, but within the time. So 22 seconds to go.
Sir, our answer is Ellslenger syndrome. D option.
You want to go with option D, Delta.
D. Yeah.
Are you
D
sure
for
about
Delta.
it?
Yes, sir.
You want me to lock D Delta? Okay, lock D Delta and let's see. And that's a wonderful stroke. So it's a straight drive for a 6. They seem to be pretty sure. Well done. So you take your time, But then again, you have to answer correctly, and it's always the teamwork. That's my advice to both the teams. Well done. Great start. Can we have question number 2 on the screen, please?
Question number 2. Question pin
Read the
nahi hai,
question,
sir.
please.
Question pin nahi hai, sir.
Okay, hold on. PIC Warriors, you'll have to pin the question. Technical
Yes,
team.
now it is. Now it is, sir.
Okay. Please
What
go ahead.
antiplatelet should be administered to this patients? Aspirin 300 mg plus clopidogrel 600 mg. Option B, aspirin 300, clopidogrel 300. Option C, aspirin 300, clopidogrel 75 mg. Option D, no preloading is required. Sir, question pin nahi ho raha.
Okay, just hold on. Technical team, what's the problem here? Why aren't we unable to pin the questions?
And now it is, sir. And option
Okay,
E, aspirin 75 mg plus ticagrelol 180 mg.
Okay, so your timer starts now, 60 seconds. Let's see what happens now. We can't hear RIC. You have to unmute yourself so that we can hear the discussion. It's an outswinger. Let's see what happens.
B
20 seconds. Come on.
Sir, our answer is B beta, aspirin 300 and clopid 300.
Okay, so B beta. How sure are you? Is it a 6? You think so?
Yes, sir.
Okay, I'm going to lock B beta. Lock it. Oh, that's the wrong answer. The outswinger got the edge into the slips and... Oh, all right. Never mind, never mind. So, my word of advice, RIC, dreadnoughts. I'm here. Look at me. Look at me. Focus. So, when you're about to answer, you unmute. Once you're done and the other team has to read the question, you mute yourselves, or either, you have the option of not talking at all. So, once they are done with the question, then you unmute and start the discussion. You do not start the discussion until the question has been read properly. All right. Don't, we get some, we lose some. So, this is the second question. You've got the first one right. Now, we are moving to question number 3.
Question
Read the
number
question,
3.
please.
Which antiplatelet agent is considered the most potent in terms of inhibiting platelet aggregation? A. Prasugrel, B. Cangrelor, C. Ticagrelol, D. Aspirin, E. Clopidogrel.
All right, 60 seconds on your screen. And I would like to welcome one of our umpires, Professor 𝐏𝐴𝐤𝐻𝐿 Siddiqui has joined us. Welcome, sir. We're hoping for a good game.
Thank you.
So we don't hear the discussion. I mean, we can't hear you. Unmute yourselves. Okay, okay. 25 seconds to go.
Sir, our answer is alpha, Prasugrel.
A alpha. You want me to lock A alpha, right?
Yes, sir.
Okay, lock A alpha. Oh, that's the second miss. No, no, no. All right, so you've missed 2 in a row. You've got to play it watchfully. There is some movement, but then you have to get to the pitch of the ball. Come on. Okay, we move to question number 4. Bring it on.
As per the recent ACC and ESC guidelines on acute coronary syndrome, which tool is used to assess the bleeding risk? Option A, stop depth. Option B, master depth. Option C, precise depth. Option D, ARC HBR. Option E, none of the above.
And 60 seconds are on your screen now.
नहीं पता ही कैसे Stop me. Dab.
All right, 25 seconds to go.
Sir, it's option A, alpha. Stop dab.
Okay, option A, alpha. Should I lock it?
Yes, sir.
Okay, I hope it's not a hat trick of wrong answers, but let's see. Lock A, alpha. Oh no! We missed this one as well, so a hat trick of wrong answers. Oh, we were dreading to have that, but never mind. You can still put up a reasonable score. We need a good total on the board for you to have a good fight from here on. Okay, so with this we move to question number 5. Bring it on.
What is true about the patient's ARC-HBR criteria? A. Patient is fulfilling 1 major and 2 minor criteria. Option B. Patient is fulfilling 2 minor criteria. Option C. Patient is fulfilling 1 major and 1 minor criteria. And option D. Patient is fulfilling 2 major criteria. Option E. None of the above.
Start the timer, 60 seconds on the screen. They have to play it wisely now.
Age one major criteria. Sir, can we have the question again?
Yes, please show them the scenario. Scenario on the screen. They want to go and take a look at it.
Option.
30 seconds to go.
Sir, can we have
Yes,
the question again?
bring the answers. Scenario. Yes, that's you have the options now. 20 seconds to go.
Two major criteria.
Sir, we're going for delta D.
You want to go ahead with D delta. Okay, I'm going to lock D delta. Fingers crossed. Let's see. Lock D delta. Oh no! That's another miss. All right, so we have had a flurry of wrong answers, and it's the 4th one in the row. So we've just, we're halfway through this innings. We've had 5 questions, only 1 correct answer so far. Come on, buck up, you can still do it. Dreadnoughts, you need to make a move now. Question number 6 is on the screen.
As per ACS guidelines, how would you like to manage this patient's heart rate in the acute setting? Option A, administer oral metoprolol. Option B, administer IV metoprolol. Option C, administer opioid analgesics to relieve pain and tachycardia. Option D, administer IV verapamil. Option E, administer ivermectin.
Okay, 60 seconds are now on your screen. So that's a bouncer. Let's see how they negotiate this one.
Sir, C, option C.
Okay, you want me to lock C, Charlie?
Yes, sir, C.
How sure are you? Okay, I can see smiles all around. That means they're not that sure. So lock C, Charlie, and let's see what happens. Oh, no. Goodness me, that's another one going past the bat, hitting the stump, and an off stump seems to be rooted out. Come on, Dreadnoughts, you need to buckle up. All right, you have 4 more questions to go. You can still put up a reasonable total. Okay, so you need to focus, and let's have question number 7 on the screen.
Which of the following trials support the use of IV metoprolol in STEMI setting? A. Commit CCS1. B. Commit CCS2. C. Metocard CNIC. D. Commit CCS2 and Metocard CNIC. E. None of the above.
And the timer starts now. 60 seconds is all the time you have, and I hope you make the most of it this time around. Come on, guys, you need to focus. You can still do it. Never lose hope. And I think you need to focus on each other. And I just have to make sure that it's the teams who are actually there, and we have to ensure that there is no support being given to them. Come on, 10 seconds to go.
D for Delta.
D for Delta. You want me to lock D for Delta? Lock D Delta. Oh, another miss. That one was the rising delivery and you missed it. Top edge and straight at fine leg, and we've been caught again. All right, Dreadnoughts. The ship is going down. So you have to bring it up. You can still put up a good fight, but I'm going to request everyone to focus on the game and concentrate hard. All right, so can we have question number 8 on the screen, please?
A repeat ECG after 30 minutes show ST elevation in leads 2, 3, and AVF, and an ST elevation in lead V1. Which of the following investigation should be done next to rule out RV in FARC as per ACS guidelines? A. Right-sided ECG. Option B. Echo and assessment of TAPSE. Option C. Troponins. Option D. RV angiogram. Option E. None of the above.
Start the timer, please.
Sir, Alpha.
Okay, they've come down the wicket. I do see a bit of Afridi in them. You want me to lock it?
Yes, sir.
They're trying to take it on the full toss. So, which one should I lock?
Sir, Alpha.
A alpha. All right. I'm going to lock A alpha. Lock it. And yes! Well done. You got this one right. And I'm really excited to see that. Well. So, we've got the second 6 on the board. And it took us a while to get there. But definitely now I think you have to keep the fighting spirit. You never know what happens when the next team comes. So, you have to be positive. And the idea is to keep fighting. You still have 2 more questions to go. You can still get to a total where you can fight from. All right. So Afridi, well done. But, be wise about your options. Okay. Warriors are ready to throw the next one. Question number 9 on the screen.
The patient is taken to the cath lab as per primary PCI protocol. Angiogram revealed a totally occluded RCA from the mid-course with a 70% osteoproximal disease. Also, RCA has an anterior origin. Which strategy would be the most inappropriate and least safe to provide guide support in this PCI? Option A, using an Amplatz guide. Option B, using a guide extension. Option C, using an anchoring balloon technique. Option D, using a buddy wire technique. Option E, B, and C.
The timer starts now. You've got 60 seconds.
Your CBL. Inappropriate or least safe. Just hear me.
$25 seconds to go. Dreadnoughts.
Anchoring balloon. Anchoring balloon be safely.
Approaching 15 seconds.
Yeah.
Come on, 11
Sir,
seconds.
E. E for elephant.
You want me to lock E for elephant. Are you sure?
No, sir.
E elephant, that's what they said. We've run out of time. Okay, E elephant or epsilon, lock it. Oh no. That's another one which has been missed by them. Goodness me. Okay, so that one right onto the pads, an in-swinger, and it's a plum LBW. That's for sure. All right. We're moving to the last question of this innings. Question number 10 on your screen.
The lesion is crossed with a workhorse wire and pre-dilated. A 3.5 into 38 millimeter of DES is deployed from ostium to mid-course. However, after deploying the stent, the patient develops no reflow phenomenon. A decision is made to administer intracoronary glycol 2B3A inhibitors. As per the ACS 2025 ACS guidelines, what is the class of recommendation of it in this case? A, class 1, B, class 2A, C, class 2B, D, class 3, E, none of the above.
And you have 60 seconds on the screen now. The last question. And let's see what we end up with.
Sir, it's C, 2B.
Okay, you want me to lock C Charlie? 2B.
Yes, sir.
Okay, they say it's C Charlie, so lock C Charlie. And oh my goodness, that's another one which has been missed. The reference was there, which was ACC 2025 ACS guidelines. Oh my goodness. So with this we come to the end, and I think the score looks quite meager, and it's a pretty low score, to be honest. A total score of 12. So only 2 correct answers. And with this, I'm going to move towards the panel of experts, and I see Professor Hafizullah Saab, sir, your thoughts so far?
I think very relevant and good questions. The team did try to attempt that, and I think probably you were more sad than they were on missing the questions. So I think it went well. I mean, it went okay. Let's see how do the PIC performs, and I think we should give some sort of an explanation later on, medical explanation for being right or wrong. So I think that is one thing we should be thinking about next time. Thank you. Excellent performance so far.
Very right, sir. Thank you very much for bucking up the teams. I think it's always a fair competition, and they all have to be ready to attempt the questions. But then we all know that the process is about learning. We do have some winners. We do have someone on the losing side as well. But it's all about learning. And we have the umpire of the day with us, Professor Abdul Hamid Siddiqui Saab. Sir, what would you say?
Thank you. Good afternoon, everybody. I think the RIC could have made up a few more questions right to put up a good score. But anyway, they tried their best to their knowledge. Let's see what the next team does, PIC Warriors.
Very right, sir. So we do have the total on the board, and that's all the runs that they can play with. Let's see what happens. We've seen funny things happening. You never know. So we have a total of 12 to beat. They have to come up with 3 correct answers. And now we are going to start the second innings, and it's going to be PIC Warriors facing the music and taking the questions. And RIC Dreadnoughts, buck up and throw the questions as hard as you can. Come on. Let's see what happens now. Can we have the case on the screen, please? Read the case, please. Dreadnoughts.
A 70-year-old gentleman, known diabetic and hypertensive with history of remote inferior wall MI, treated with thrombolysis in 2010. Now presented to the emergency department with central chest pain of 4 hours duration and ECG revealing ST elevations in anterior chest leads. His heart rate is 104 per minute, blood pressure is 90 by 54 millimeters of mercury, chest auscultation shows bilateral air entry, and bedside echo shows an EF of 35% with hypokinetic anterior and inferior walls. A decision is taken to proceed with primary PCI.
Okay, so Warriors, you'll have a few seconds to settle yourselves. Let me know when you are ready for the first question.
Previous inferior, the SK given. I'll show you the EF 35% and primary PCI. Done.
Okay, so are you ready for the first
Yes, sir.
question?
Yes, sir. We are ready.
They are ready. Bring it on. First question on your screen. Read the question, Dreadnoughts, with the options.
All of the following are reasonable choices of anticoagulation for this patient except
Read the options also.
A. Unfractionated heparin, B. Low molecular weight heparin, C. Fondaparinux, D. Bivalirudin, and E. None of the above.
And your timer starts now. You also get 60 seconds to answer.
Decision is it. A and B is common. Diction. And option C and D. On the Prenox is not given. On the not given. Sir, is Charlie C. On the Prenox.
You want me to lock C Charlie. So are you sure about it?
Yes, sir. We are sure.
They seem to be sure. They want me to lock C Charlie. Lock C Charlie. And that's a 6. Came down the wicket and that's over. Long on for a beautiful 6. Well done. Well played. Great start. So we've had some good starts. But let's see how it goes from here on. It's not a big total, but they still have to play wisely. Question number 2 on your screen now.
The patient is taken to the cath lab. Which access site should be preferred for primary PCI? Right radial artery, left radial artery, right ulnar artery, left ulnar artery, and right femoral artery.
Timer starts now. 60 seconds.
Option Alpha, sir.
Are you sure about
Right
it?
radial artery. Yes, sir. We are.
A Alpha. He's come down the wicket. I think he's going to get to the pitch. And let's see whether it goes for a 6 or not. Let's see. Lock A Alpha. And it's a 6 for sure. In fact, he took it on the full toss. And that's gone miles into the air. Out of the boundary for a 6. Very well done. So that's great start. 2 6s in a row. The scores are level. Okay. So you don't have a lot of work to do. But let's see. Because the marks are going to matter. Your score eventually is going to matter. It may just get down to the run rates and there are formulas in place. So let's see what happens from here on. Okay, question number 3.
Which famous trial demonstrated that radial access in primary PCI setting is associated with lower 30-day mortality in comparison to femoral access? Matrix trial, rival trial, rifle STACS trial, radial STEMI trial, or Rivavor trial?
Okay, your timer is 60 seconds and it's on the screen.
No, rifle stays STACS. COD. C. Matrix trial for no. B for no. It's between C and D. It's C and D. C. Sir, it's Charlie. Rifle STACS trial.
Okay, so you want me to lock C Charlie. Okay,
Yes, sir.
lock C Charlie then. And yes, that's a wonderful strike. This was it was a tricky one, but they got it in the end. Very well done. And with this wonderful stroke, it's a hat trick of 6s. And we also know who the winner is today. But still, I think we have a few questions and it's all about learning. So we'll get and play till the last ball. We'll get to the last question, that's for sure. All right, very well done. Well done, PIC Warriors. You've done well. Well, let's see how far you go with the score. Okay, question number 4 is on the screen.
The patient has a feeble radial access and despite passage of 3 minutes and 5 attempts, radial access was not obtained. What should be done next? Use ultrasound guided transradial access, switch to right ulnar access, give IV fluids and then reattempt right radial access, switch to right femoral access, administer SK.
Okay, 60 seconds are on the screen.
Option D. Option D, sir. Delta. Switch to right femoral access.
Okay, you sure about it?
Yes, sir.
Okay,
100%.
Gilchrist is now again coming down the wicket and he's smashing it over long off. Let's see. All right, you want me to lock D Delta?
Yes, sir.
Lock D Delta. And that's a 6. Gilchrist seems to be on fire. Well done. Very well played. So, everything is on course at the moment. 4 out of 4. And a score of 24. Well done. Very well played. Okay. Question number 4. Read it, please. In fact,
The right
question
femoral-
5 it is. Question 5.
The right femoral is scrubbed. What should be the needle entry point to obtain femoral access? 1 centimeter below mid-inguinal point, 1 centimeter above mid-inguinal point, 2 centimeter below mid-inguinal point, 2 centimeter above mid-inguinal point, none of the above.
All right, 60 seconds
C.
is all that you have.
One a day, giving a day, C, 2. Confused between A and C. 1 centimeter. What a bunch.
Discussion is ongoing. Let's see what they end up with.
2 fingers. 1 centimeter. Option alpha, sir. 1 centimeter below the mid-inguinal point.
You want me to lock A alpha?
Yes, sir. Lock it.
Okay, they want me to lock A alpha. Lock it. And that's the wrong one. You were thinking on the right lines. You said C and you were right there, spot on. And that's the first miss. Okay, but never mind. You guys are doing a brilliant job at the moment. And we know that, you can always miss something here and there. But still, the teamwork is there. Very well done. So, with this, we have half of the questions that we are done. Just one mistake so far, 4 correct answers. And with this, we move to question number 6 on your screen.
Regarding the femoral access, which of the following practices have shown a reduced rate of vascular complications? Use of ultrasound guidance, use of fluoroscopic guidance, use of blind palpatory method, use of micropuncture needle, or using a 5 French sheath instead of 6 French sheath.
Okay, 60 seconds are on the screen now.
Radial access pleural access complication rate ultrasound guided or fluoroscopic ultrasound guide. Sound guided there. Ultrasound. Sound guided fluoroscopy head the take you. Do you say? So I guess is ultrasound.
25 seconds to go.
Sir, it's option alpha. Use of ultrasound guidance.
Are you sure? Should I lock
Yes,
A
sir.
alpha? Okay, they
Yes,
are
sir.
saying it's A alpha. So let's see. Lock A alpha and see what happens. And it's absolutely correct. It's over extra cover for a 6 this time. So teamwork into play. I think everybody was on board. They had a bit of a discussion, but very nicely done in the end. Well done. Another one which is absolutely correct. Great job. Moving to question number 7.
After securing the femoral access, a check peripheral angiogram is performed that revealed the sheath to be placed in superficial femoral artery. Which of the following is true? The sheath is in the ideal location and the risk of vascular complications is minimal. It is high stick puncture and the patient is at risk of retroperitoneal hematoma. It is a low stick puncture and the patient is at risk of retroperitoneal hematoma. It is a low stick puncture and the patient is at risk of pseudoaneurysm. It is a high stick puncture and the patient is at risk of pseudoaneurysm.
All right, start the timer, please.
Femoral access usho ka na. O pero juga mo nga perform kung nakikita shoot jikam de SFA which is true. It is in the ideal location at the risk of complications of minimal stick puncture. The low stick puncture and the patient at risk of retroperitoneal hematoma. Low risk of puncture and the patient at risk of pseudoaneurysm. It is a low stick puncture and the patient at pseudoaneurysm D. Between C and D hoga. So
25 seconds to go.
what do you say? Sir, it's option delta. It's a low stick puncture and the patient at the risk of pseudoaneurysm.
Okay, option delta. How sure are you?
Sir, 99%.
He's saying he's sure 99%. Okay, let's see. That's pretty sure. Lock D delta. And he's absolutely right. You are 100% right. Very well done. Very well played. Great job. It's great to see you guys discussing it and coming up with the right answers. Wonderful, wonderful play here. Well done. All right, moving to question number 8.
After securing the sheath, angiogram via the guiding catheter revealed a thrombus-laden critical proximal LAD disease with the thrombus linear dimension measuring 1.75 times the vessel diameter. The circ is normal. What is the patient's TME thrombus grade? A 1, 2, 3, 4, or 5.
All right, the timer starts now. You've got 60 seconds to answer. That's a spinning delivery. Let's see where it goes.
LAD linear dimension measuring 1.75 times the vessel diameters. If the circ is normal, the patient. It's 2 or 3. I think it's B. It's B. What do you think? 5 times the diameter is normal. Maybe thrombus rate is.
25 seconds to go. They want to take their time.
Not sure, but
they have to get to the pitch of the ball.
Between 2 and 3.
Not sure.
Diameter घट देगा ना. Diameter घट देगा.
15 seconds to go.
Sir, option Charlie. 3. Timmy 3.
Timmy 3. Option C, Charlie. You want me to lock it? How sure are you this time?
Sir, 80 to 90.
80 to 90. Okay, let's see. Lock C, Charlie. Oh, that's something which you have missed this time. Okay. So he was getting there, but I told you he had to get to the pitch of the ball. Anyhow, well played. That's the second miss of this innings. Never mind, it's still a pretty good score. All right, we've got 2 more to go with second last question of the match. Here we are, question number 9.
Primary PCI to LAD is proceeded with a 3 into 33 millimeter drug-eluting stent, following which right system angiogram is done that shows a calcific vessel with total occlusion from mid-course. What should be done next? Proceed with PCI to RCA up front via integrate approach using single stick, secure a second axis for double stick and proceed with PCI to RCA via integrate approach, secure a second axis for double stick and proceed with PCI to RCA via retrograde approach. Don't attempt PCI to RCA at this time. Use IVUS to define the proximal cap of RCA occlusion of for subsequent planning of staged PCI to RCA.
And your timer starts now. 60 seconds.
Don't do 2 seconds. Acute second now, then is the C option. So now since these we see in next setting, there is no need. No. I am sure. I am 100% sure. Option Delta, sir.
Okay, the captain says I'm 100% sure. You want me to lock D Delta?
Yes.
So Gilchrist is again down the wicket and he wants me to lock D Delta. Lock it. And he's absolutely right. Very well played. Brilliant answer. The captain was spot on. That's wonderful. I think you definitely are in the right direction and coming up with the right answers. Brilliant. That's great play and we're really excited to see this. And with this we move to the last question of the match and it's question number 10. Bring it on.
Post PCI, the patient remains stable vitally. However, he complains of right arm pain and has a hematoma extending 10 centimeters proximally from the axis site. What is the grade of the hematoma as per EEZ classification?
So, option A is 1, B is 2, C is 3, D is 4, E is 5. 60 seconds on your screen. I can't see the answering team on the screen. Can we have them on the screen, please?
It's
There is some reverse swing. Let's see whether they play it in the right direction.
Out the grip raise. Other grade 3 and 4 and 3 and 4. Burhan, what do you say?
25 seconds to go. $15 seconds to go. Come on, Warriors. 10 seconds. 8, 7.
It's beta, sir.
Eta.
Beta.
B beta.
Yes, sir.
Okay, so they said B beta. All right, lock B beta and let's see what happens. And And it's correct. Brilliant. I think that was coming in, reversing like anything, and they got this one right as well. Brilliant play, brilliant answering, and they've come up with a very good total. A score of 48 with this. I think we now know the winners today, and by a large margin, it was PIC Warriors who are the winners. Commiserations to RIC Dreadnoughts, but you know what? It's always the competition which is important. It is the drive to do better every day, and we learn every day, all of us. So great job, both the teams. You've done really well. You should be proud of yourselves. And we have our dignitaries, Professor Hafizullah Saab. Sir, your comments, your thoughts?
I think excellent display of knowledge, one. Second, consultation. It's very important that we learn that whenever you want to acquire more or want to learn more, peer learning is very important. And this is, I think that's where Burhan comes to help. And all Burhans are very helpful when it comes to learn new things. So I think that's very good teamwork that did it, and mashallah scored well. But I was very a little unhappy they missed femoral stick. It means that in PIC, they're all doing radials and nobody knows where to stick when it comes to femoral. That's little sly, huh? Thank you. I think you, mashallah, moderated it very nicely with lots of enthusiasm and excitement and zeal. Without you, this will be a dead play. Thank you.
Thank you very much, sir. I knew somebody as astute as you would definitely pick that point, and that's exactly what you did. Too many radials and not femorals, not being done enough. But I think these are the points which we all have to take home, and some extremely important points. It's the teamwork which matters, the consultations and the peer reviews. Wonderful point. And we do have the umpire of the game today, Abdul Hamid Siddiqui Saab. Sir, what do you see today?
Thank you. Congratulations to the winning team, PIC. They were very confident, and there was ooze of knowledge from the gesture, and that showed the score they achieved. Anyway, the other team, RIC, I think they have to buck up for them. There's always a chance to improve upon. So this is just a competition, not a game of life and death. So all in all, it was a very good scenario, good day-to-day scenario, which is revises our ACS knowledge, and both for the consultant as well as for the trainees.
Thank you very much, sir. So we all know ACS is extremely important. We all come across these scenarios and these patients. So I would like to take both the teams on board. Do we have RIC Dreadnoughts? Are they there? Can I take the comments from them? Do we still have them? Okay, Dreadnoughts. Any thoughts from your end? Well done. You tried hard.
Sir, we hope we'll do better next time after preparing with the latest guidelines.
Okay, so you should keep your selves motivated, because you see, winning and losing is part of the game, but it's always something where you have to improve yourself the next day. We are always striving for improvement. We know that each and every one of you is absolutely brilliant when it comes to the work, whether it's our trainees here in this part or any other part. I think they are all trying their best, and the idea of this league is to promote competition which is healthy, and to make you all go through your theories, your practical work, and then the implementation comes into play when you address these issues, and this is something which happens. So great job, and hopefully next time you will be better prepared, and we definitely hope for that. And this is part of the game, so well done, and best of luck to all of you. And we do have the winners of today's game. It is PIC Warriors. You fought like warriors. Your thoughts, please.
Thank you very much to the Wilson by providing us so much a great opportunity to all of us to explore and flourish on such a platform, challenging questions that is also helpful for our knowledge and experimental work here in our setup. So great work, and we look forward to the next match, and best of luck to the Wilson, and to all my teammates, good luck.
Yes, so best of lucks all around to everyone, and we are all learning. Thank you very much for this wonderful show. And with this, we come to the end today, and I will beg leave along with my team, and hopefully I'm going to see you next time with another game, another tough competition, and a lot of good stuff to take home, because there's always going to be learning for all of us. With this, I now beg leave, and I'm saying Allah Hafiz from this end. Till next time, take care.